Nurses have seen a fall in the real rate of pay, and that's why, very unusually, the Royal College of Nursing has decided to ballot for action, and a majority of those who voted have voted for action.
Dominique, nurses going out on strike, I can understand it, and I think a lot of people will support them. If you're waiting for an operation, if you're waiting for some treatment, if something's been delayed, if you're one of those millions of people who can't bear to get another letter saying, very sorry, your operation's been delayed, it's going to be hard, isn't it? And I know nurses are aware of that. How do we fix it?
I mean, it's not, just going to be hard. I think people are going to die, probably, as a result of the strike action. I'm not one of the people, though, that would say that, they shouldn't strike at all, or that I don't have any sympathy with them whatsoever. I think it's an absolute travesty that in this modern day and age you've got nurses having to go to food banks. It's just ridiculous, especially when you take into consideration their workload, which will have significantly
or eat the
increased.
Leftovers of patients.
Yeah, it's something that you just don't want to hear. The only thing I would say, perhaps to sort of present the other side, is a lot of people are feeling as though the pay rise that they're actually asking for, which is 5% above inflation, it's currently at 12%, is that workable? Because even Labour aren't really saying that they're going to fully get behind that, because in this current economic circumstances, 17% pay rise, I'm not sure how that will be done.
Let's talk to Hilary about this. Hilary, just quickly before we get into the detail, because there will be, and we were asking for this earlier, there will be people who are really, really concerned about this. And Angie has said, I'm extremely worried. I'm due to start radiotherapy in 3 weeks. I'm wondering if this will affect me. There will be people who need cancer treatment and emergency services and are waiting for that, like Angie, who will be very concerned what the impact will be. Do we know yet?
Well, the wards will be staffed. ITU will be staffed. A&E will be staffed. Nobody with an acute medical issue will be ignored. Having said that, of course, there will be backlogs. We've already got 7 million people on the waiting list. That will increase. Elective surgery, hip replacements, knee replacements, that will be postponed, cancelled. People who've been waiting already for a long time will have to wait even longer. These things will happen. People have been asking me this morning why I'm wearing such a bright tie. Do you remember, the first year of the pandemic, we clapped on our doorsteps wearing these colours, supporting the nurses and appreciating the goodwill that they had earned doing their 12-hour shifts, doing unpaid overtime, working their guts out, and all that goodwill. What does it count for them? Nothing. They're at food banks because they can't feed themselves and their families. Their experienced nurses' pay, in real terms, has gone down 20% since 2010. They're doing 12-hour shifts. The bursaries under Jeremy Hunt were stopped. So nurses start off their careers in debt. New nurses who are supernumerary are actually working on the wards as nurses unpaid. So the derisory 4.75%, which the independent pay review body has suggested they have this year, equates after tax about £5 a day. I mean, 4% of something that is very low already is £5 a day. So are we going to treat nurses as a special case? I know about the economic circumstances we're in, and if we pay everybody to match inflation, it's a never-ending spiral of the same.
Well, the government say £9 billion is what it would cost to cover that.
Yes, it sounds like a lot, but what did they waste on ITU, on IT? In years gone by, billions. What do they spend on private companies doing COVID-19 tests? Billions. If they paid nurses a proper salary which they deserve right now, we wouldn't need agency nurses, which cost 3 times as much. We wouldn't need locum doctors, which cost 3 times as much. We'd actually have a service which is
Jacqui, Dominique points out that Labour haven't got behind the 17% bid. Are they in a difficult position because that would be unaffordable?
Yes, they are, because as Ben has pointed out, that's £9 billion of NHS funding, which of course is necessary to bring down the waiting list to make sure that patients are being treated. And unfortunately, it's even more difficult than that, because these are nurses that have voted for action. We're also going to see porters, people who work in labs, receptionists, the people who are organising the operations in the first place. They're probably going to vote. Doctors, they're going to vote for strike action as well on the basis of pay. So I think, Wes Streeting, Labour's shadow health secretary, has been pretty scathing, rightly, I think, of the government's unwillingness to meet with the Royal College of Nursing to talk about a way through this. But Labour haven't, and probably responsibly, nor should they, say we will definitely pay whatever people are asking for, because these are tough economic times and there are difficult decisions that need to be made.
Do you know, as much as anything, it's not about pay. It's about nurses saying, we dread going to work because although we love the job that we do, we can see that the care quality is going by the wayside. We want people to have a good experience. We want them to have good care. But those nurses who are still there are working for the 47,000 who've recently left. And they've left because they have no option.
And one of the other things that the government has consistently failed to do, Jeremy Hunt, interestingly, argued for it when he was the Health Select Committee chair, is to have a proper plan for the workforce in the NHS. We've got a national NHS, but we don't have a national workforce plan.